Hello, mate to Thrive Nation. Today's all about hair health and scalp health, and I've got the top surgeon, hair restoration surgeon, I think in the whole of the US, and he's got a prolific bio. And I know I've introduced him on the intro, but over 34,000 patients treated, 12,000 PRPs, and everybody knows that I've been doing PRP for 15 years. Incredible technique, and 12,000 implants, hair implants. So it's just a privilege to welcome Dr. Alan Bauman from Bauman Medical on the show.
Thanks, Steve. Great to be here with you.
Brilliant. Now, what I want to ask about hair loss, why is it so important to people? And I know it's not only males, and people have this archetype that it's only males, but why is it so important for people that, they should keep healthy hair and keep their hair restored and then replace their hair if they lose it? Why is it such a big deal?
Yeah, well, I think it stems back to the point that hair is a very emotional organ. So, what do we mean by that, right? When you have excellent hair and your hair is looking good, you're feeling good about it, you see yourself in the mirror, it's natural to notice that and to feel great about it. And, you only have to think about what a bad hair day means, to a woman potentially. If she's having a bad hair day, you probably want to stay out of her way. And I think, a lot of folks have asked me about that. Why is hair so important? We don't need it to survive. It's not like your digestive tract, you don't need it to get around the planet. But I think hair as a biologic clock, something that we can see from the outside, and also as a barometer of our health, has really evolutionarily over millions of years become something that is become valuable to the human race. I mean, just think about, nonverbal communication. You're in a cave, the cave woman, the cave man. You want to know if that person is a viable mate and can propagate the species. You want to basically make a snap judgment about their health, their nutritional status, and their age. Whether you're a man or a woman, propagating the species evolutionarily is one of the more important things to do. So
Brilliant.
I think that's how it kind of turns out. And if we comport that into today's world, hair is an important sign of youth and vitality. And that's why it's so important. And if you're losing it, it can really affect you detrimentally. So that's the unfortunate thing. Like here in the US, 80 million Americans are suffering from hair loss. And we know that it has an important effect on their quality of life. Many people feel like it's out of their control, unfortunately. But in reality, it's not. There are effective treatments. And hopefully we'll get a chance to talk about some of that stuff today.
Absolutely. But maybe you want to just unpack, the status of hair health worldwide, and maybe in modern day cities. I'm not talking about in rural areas, people living on organic farms or in blue zones. I'm just talking about modern hair health. And, I've been in practice 25 years. I've never seen the degradation of chronic disease just impact all ages, from the youth all the way to the elderly. What's happening with our hair worldwide?
Yeah, I think it goes down to really the microorgan of the hair follicle. And of course, we're all born with about 150,000 of these little microorgans on our scalp and a healthy head of hair. And their job, like a 3D printer, is to produce this fiber, this hair fiber that we see. We can touch it, we can feel it, we can style it. And the interesting thing about the hair follicle and this mini organ is that it's, as I said before, maybe very, very responsive to our health status. So whether it's nutrition, inflammation, toxins coming in from the outside, hormone levels or imbalance, changes in our circulatory patterns. I mean, there's our stress level, exposure to cortisol. These are all insults to the hair follicle. And again, it all ties back to the barometer, if you will, of our internal health. Because think about this. I mean, the hair follicle is one of the highest metabolic cell populations in the body. And so, and its product is something that we can see, in the mirror in a moment and make a snap judgment. The quality of the hair fiber that's produced is directly related to all of those influences. Do we have good nutrition? Are we well nourished? Have we slept well? All of these things, are hormones in balance and so forth and so on. Of course, overall health, as you know, being in the regenerative field, we've seen this degradation across all strata of the populations, especially in developed countries and the big cities, and we're unhealthier now than ever before. And so, could the hair loss process that we see starting much younger now in both men and in women, certainly the cohort of patients that we see now is so different than what I saw many years ago, nearly 30 years ago when I started my practice. We're seeing patients at a much younger age dealing with a hair loss situation.
Mm.
Now,
Now,
Some of it may be related to the fact that we can address it earlier and track it
mm,
earlier. Our tools have gotten better, but there's no question that we're seeing a lot more hair loss. I think it's increasing.
yeah. So I've been doing functional medicine for 18 years and we can assess, from anything to everything. I've never assessed my follicles and my hair. As I said offline, my grandfathers both were having haircuts once a month, well into their 70s. And so really a lot of hair, a lot of gray hair. But when should people start assessing their hair and how do they assess the quality of those follicles and whether they're going to lose hair or not? So, I mean, I've just taken a quick genetic sort of understanding of, oh, my dad's still got a crop of hairs. He's in fact 83 today. It's his birthday, and he's got so much hair, 60% black hair, maybe 40% gray hair. But how
Yep.
do people go about assessing the quality of their hair?
Yeah. So this is really important because, some people can look in the mirror and just wake up, after a few years of hair loss and say, oh my God, my hair is totally different than it was in texture and quality and color and volume, even in its locations, right? It's growing out of my ears, but it's not growing in my hairline anymore. And so obviously it doesn't require a microscope to determine what's going on for some of those patients. But here's the thing. If you feel like you're at risk, and this is something like you've just said, you've looked at your dad, and certainly I would look farther into the history, the what we say, the family tree, if you're happen to be, on social media and your family is connected that way, or if you're at a family picnic, either way, kind of do a quick survey of the blood relatives and see what's going on out there. But because certainly hair loss has a very, very strong hereditary component. And so it all starts anytime after puberty for both men and for women. Most people consider male pattern hair loss starting as a receding hairline and thinning in the crown. That's the traditional male pattern hair loss or androgenetic alopecia. And that is chronic. It's progressive. It gets worse with time without treatment. Today, we know it's triggered by the body's hormones. And if you don't take action early, the follicles get so far miniaturized that they become beyond repair. And then really the only fix is a hair transplant at that point. But the good news is that if you catch it early, there's interventions that we can do. Maybe non-medical, maybe lifestyle, maybe pharmaceutical, maybe regenerative, depending on what we need to rejuvenate the function of those follicles to produce, once again, a thicker, longer, healthier, stronger, darker, hopefully, healthier looking hair. Now,
Yeah.
in women, most women come into my practice around menopause. That's the most common time that we see changes in hair volume and thickness in women because hair loss happens more diffusely, more subtly in women. It's not a loss or pattern like we see in men. We see more of a diffuse thinning around the frame of the face. But later on, it can recede the hairline and require the need for transplantation. But women can also lose their hair very early in life as well. Hormone abnormalities like PCOS happen in the early years of childbearing, and it can progress to hair loss problems as well as a constellation of other symptoms. Childbirth is often a trigger for women where they see shedding around the time after the baby is born. But usually perimenopause and menopause are the times most commonly that we see our
Mm.
hair loss in women. And certainly my practice is made up almost 50-50 exactly of men and women struggling out there with hair loss and looking and seeking for solutions.
So, Dr. Bauman, do they come in and then you use a microscope, or how do they actually get it assessed?
Yeah, great question. So when a patient comes in for a consultation and an evaluation, it's just that we're going to do it, first of all, a deep dive, as we've discussed on, well, let's just say the functional side of things, right? Taking a 360 approach to their lifestyle. Maybe hair loss has happened earlier. Maybe it's just happening more recently, but we want to find out. Have they been sick recently? Are they on a good nutritional path? Are they sleeping well? Do they have inflammation in other areas? Are they suffering from, let's say, gut inflammation or some skin inflammation that could be dysregulating their hair? These are important things that we'll look at. We might do some blood work based on their medical history.
Mm.
Absolutely, of course, we're going to look at their scalp from across the room and their hair. We want to judge their hair quality, the pattern, the curl, the shine, the texture, and then get our hands dirty, right? As we say, we want to look at the scalp, touch the hair, see if it feels brittle or dry, if the scalp is exceptionally oily. But yeah, we're going to look with microscopes, not just loop magnification, but AI powered microscopes to literally count the hairs in different zones, because they don't call it male pattern hair loss for nothing. It's a pattern because there are some areas that are spared, like, for example, the sides and the back of the scalp. the occipital zone, if you will, is immune to male pattern hair loss. And then let's look at the crown area to see, is there some change that's identifiable in the quantity of the hair, the numbers of hairs per square inch or square centimeter, the caliber of the hairs down to the micron. What is the average hair width? And the computerized microscopes can now give us all of that information, not just in the crown, but we can look in the temples, the frontal zone, of course, and see what's going on. And then we can also take what we call a hair bundle measurement. So think about a ponytail has a certain thickness, right? A cross-sectional area that you can feel. And so if a woman takes her hair into a ponytail and it feels like a horsetail, that's good. There's a lot of hair there. But over time, women will say, my ponytail has to be wrapped 2 or 3 or 4 times, much differently than it was years and years ago. So that cross-sectional area becomes much smaller. And we can measure that specifically in different areas of the scalp using a caliper that's stereotactically measuring different zones. So we go to the same zone again and again. And that forms a baseline, helps out with the diagnosis. Is there a pattern? And also enables us to track over time in the future.
Sure. Now that's quite comprehensive. If you're listening out there, I don't think you've maybe gone through these tests. I mean, it would sound like that I would need to go to and get mine assessed. I just think life has changed so dramatically. You can't just go look at your dad or your mom's dad and your grandparents and say, so, are these tests available? Obviously at Bauman Medical, you're a medical robotics pioneer as well. Is that where it comes through with the assessment and then also when you do your transplants? But are these sort of assessments available worldwide at surgeons, rooms that are doing hair restoration?
Yeah, unfortunately, hair specialists are few and far between. There's only about 200 board-certified hair restoration physicians in the world, and not all of us have AI-powered microscopes. The common dermatologists, and there are, tens of thousands, not 100,000 of them here in the United States. Most of them don't even have a way to look at your scalp under the microscope, and they're making a judgment call based on your appearance from across the room. So when was the last time you had your blood pressure judged from across the room accurately? That never happened in the history of the world. So you can lose 50% of your hair density without it being noticed by the naked eye. And that's a proven scientific fact that's in the clinical literature. We see it every single day here in the practice. So if you're trying to judge the response to treatment without taking a measurement, if you're trying to judge your appearance in the mirror based on some vitamin that you're taking or some topical ointment that you ordered online, the chances are very good that you will never, ever be able to measure or notice the results. And that's why people give up, unfortunately, way too early on even viable therapeutic effective regimens because they're not measuring. So if you're serious about hair loss, like you're serious about the rest of your health, you better measure it. I mean, you wouldn't, drive around and sniff your gas tank to see if it's full or not. You would look at the gauge. And so Let's get a measurement. And let's see how much hair you have truly in each area of the scalp. And even if it's just a watch and wait approach, even if you just want to check it out twice a year and see where it's going, no problem. We can do that for you. But that's why patients travel from around the globe to Bauman Medical, hair transplant and hair loss treatment center here in beautiful Boca Raton, Florida, because it's very difficult to get these kinds of assessments elsewhere. And that's why we stay at the cutting edge.
That's cool. And I mean, it's the art of biohacking, isn't it? You can only manage what you're measuring. And I think that's fundamentally important. So let's talk about some buckets of what causes hair loss in terms of first lifestyle. I think that's really, really important because people need to have a foundation, of a healthy lifestyle before they even probably start the process. Otherwise, it's going to be a difficult one. And then looking at pharmaceuticals, I saw a patient today who had been on finasteride with serious complications and libido issues and testosterone issues. It was very sad. A young man of 32 years old. And it was, I was sitting there with my health coach and we were looking and he was, was absolutely distraught after going through this. So it's real and it happened today. And then looking at any supplementation. So let's start with lifestyle, Dr. Alan, and tell us what's the most important things to help with hair health.
Well, I think, I became encouraged to look at scalp health many, many years ago as I learned that many patients were dealing with some kind of inflammation or other dysregulation right at the level of the scalp. And this, in my early years, I was doing hair transplant surgery. I want the surgery to heal well. I want the follicles to grow well. And what I noticed is that patients that had inflammation of the scalp were not such great candidates for hair transplantation and did not get such a great response from medical treatments. So if we talk about scalp health first as kind of like the soil for the plants, if there's excessive inflammation, if there is, let's say, an overproduction of oil and exfoliation and not a cleansing of those areas, you could get a disruption in the microbiome of the skin of the scalp. And when that happens, it's very clear an overgrowth of fungus, specifically Malassezia, is the one that most commonly causes seborrheic dermatitis. And dermatitis is inflammation of the skin. Seborrhea is this excessive oil production. And so if that's all happening together, it's a fertile ground for this microbiome overgrowth, and things get dysregulated, inflammation occurs. You could get scaling of the skin, you could get pain, you could get sores, and worst case scenario, even beyond that, infection, folliculitis, and so forth. So making sure the scalp health is on point is probably one of the primary things that we do. And in fact, at the clinic, it's such an important piece of the puzzle that I have an entire department of folks designed to help keep the scalp health on point. And for those who are dysregulated or having trouble with their scalp hygiene, sometimes it's as simple as just changing the frequency of their shampooing. Maybe they're doing it too often or too little. And just like skincare needs to be tailored to the specific skin chemistry and the age of the client, same is true with scalp health. And so there are therapeutic interventions that we could do in the office to exfoliate the scalp, to cleanse it, to address seborrhea, to address inflammation, because excessive inflammation and even autoimmune conditions can occur that really destroy the hair follicle. And there's a lot of ways that we can mitigate that.
I've got questions here because I think this is important. This is important of lifestyle. A lot of my audience is, well versed in nutrition and, stress management and exercise and that. But, a lot of my patients use hair and shoulders or neck and shoulders or head and shoulders. And you look at the back of this thing and all the toxicity in there, and they say, well, I've got this cradle cap, I've got this dandruff, I use it, it goes away. And then I say, listen, bring the bottle, let's have a look at it. So let's talk about shampoos, maybe conditioners, what they should be using, what they shouldn't be using, because I can guarantee you a lot of my ladies out there, and 80% of my patients are females, are using the wrong products and then destroying their hair, or even the men not sure what they're using to help the health of their hair from a lifestyle perspective.
Sure. So the first thing is if your scalp is itchy, flaky, burning, irritated, tender to the touch, or any of these items, any kind of symptom, please listen to your scalp. It's trying to tell you something, right? I mean, if you had a big rash on your arm that was itchy, tender, flaking, irritated, you would go see a dermatologist about that. Well, you need a scalp specialist if that's happening. I mean, a little bit of head and shoulders might be helpful because it does impact the overgrowth of that fungus that we talked about. It's specifically designed to target Malassezia. And I happen to be very close with some of the PhDs who worked on that with Procter & Gamble. In fact, Head and Shoulders is such a popular shampoo. It's the most popular shampoo in the world. They sell 1,000 bottles a minute. It's unbelievable. But what that tells us is that there's a lot of folks out there with unhealthy scalp. And there's also a lot of myths. Everybody's, if you tell somebody, oh, I wash my hair every other day, half the people will say that's too much. Half the people will say that's too little. Okay. So you have to tailor it specifically to the situation, just like you would never use a bar of soap on your face. You have to use the right cleanser and conditioners for your scalp. So folks that have curly Afro-textured hair are going to have a different methodology and different product selection and different modes of cleaning the scalp than someone who has straighter, thinner, finer Eastern European hair. And so there's two different ends of that spectrum. And that's why when you go to the supermarket, there's thousands of bottles of shampoos and conditioners, from lightweight conditioners to the heavy, thick masks. And sometimes, this needs to be tailored and used seasonally because obviously your environment can change. So, I mean, there's a lot to unpack there. Maybe we could spend a whole day just talking about what's the correct shampoo regimen for one person, and it will be wrong for the next person. Okay. So but we do virtual consultations for that.
A consultation, basically, I was going to say, is a summary. You need that. But I want to press you on this Head and Shoulders. I mean, I've had so many people talk about toxins, and the average woman puts on 196 chemical toxins by 9 o'clock in the morning. Toxicity is one of the biggest drivers of disease that I've seen. Glucose control, inflammation, and toxicity, three huge pillars there. Let's
Sure.
just say it like it is. All these shampoos with
Yeah.
all these toxins in, and I can be honest, after 25 years of practice, I'm moving away from a lot of these toxins on the skin because they get absorbed. They damage the microbiome, the skin microbiome. So give it to us straight there. I know it's
Yeah.
individual, but I need to know about the toxicity.
Yeah, so it's all about the dose and the frequency, right? So certainly, what happens is that many of these ingredients become what they call villainized, right? So, for example, let's just take the easiest one: sodium lauryl sulfate, right? There's a whole lot of information about how sodium lauryl sulfate is this awful, terrible toxin, and it probably is at high doses. There's no question about it. But and this stuff is used to degrease engines. Why is that? Well, sodium lauryl sulfate has a unique property. It's a surfactant. What does that mean? That means it's a detergent. So if your scalp is exceptionally dirty and needs to be exfoliated, you need a strong surfactant. However, if your skin is relatively, let's just say more friable, more fragile, then you should not use such a harsh shampoo. So some of these shampoos, like Nioxin, for example, have been touted for thinning hair for many, many years, but they contain ingredients that are just so harsh on the scalp. And so if your scalp feels tight or dry or itchy after you do the shampooing and conditioning, you probably want to look at something else. So but the problem is that when you take out a surfactant that's been villainized, like SLS, as we just mentioned, what is it being replaced with? Well, that could also be a toxin, for example. They just don't know yet. And the end result is that it's still a surfactant. It still could be stripping the natural oils and disrupting the microbiome of the scalp. So, as I said, it's a delicate dance. Now, my shampoos are designed to be clean. They're designed to have ingredients that are helping with hair growth. They're designed to have ingredients which are not going to create some kind of, God forbid, allergic reaction or sensitivity on the scalp. And I'll always tell patients, look, it's not one size fits all, but it's a one size fits most. So ingredients like caffeine, green tea, saw palmetto, some of those ingredients are very good for hair growth. And that's what we have in the Bauman line of hair care products. And we work very, very hard. I've had my own shampoos for over 20 years in the practice under the Bauman brand. And we did that because many patients were asking us, what should we be using on our scalp? And I have a variety of different pairings, right? So some of the pairings are going to be more for boosting hair growth. And then some of them are going to be more for those who have inflammation. Some of our newest offerings contain CBD to address inflammation at the level of the scalp. And that's been very, very good and has a surprising effect for most patients when it comes to inflammation. So those are just some different examples of ingredients that you should look for, maybe shouldn't look for, as you go through, this process of trying to figure out how much shampoo, what shampoo, and how often you should shampoo and condition.
Yeah, incredibly fascinating and very unique and probably very unknown with even in the natural health and medicine world. But maybe just I thought of a career, and you probably have already been doing it, but a hair health coach. Do you have hair health coaches? Because I mean, we all can't see Dr. Bauman to look at, we can probably buy your shampoos and your products online for sure. But are there other people that are not obviously the surgeons and doing a lot of the medical work that can help people online or in person?
Absolutely. So think about the world of trichology, which is the study of hair and scalp, as a medical adjunct. So this is someone who is more like a mid-level practitioner, probably not a licensed physician or prescriber, but could be someone who is a cosmetologist with more elaborate training, a certified trichologist. WTS actually is a great trichology school. Under the Bauman Institute, we also have the Hair Coach program. And the Hair Coach program has been in existence for over a decade, probably 15 years or so. And there's 1,000 hair coaches that are out there. Now, do they continue their training, continue their education? You've got to search it up. But through the Bauman Institute, we do offer hair coach certifications, and we hope that those folks continue their education. And today, they can gain that education through classes that we give online, through physical, literally didactic classes that are done here in Boca Raton, where we demonstrate how to use the different devices for hair measurements, how to examine the scalp under the microscope, how to pluck hairs and examine them. under polarized microscopy, which is a really interesting Italian technique. And then also how we apply regenerative treatments, whether they be injectable treatments that require a licensed medical professional like PRP. And we have PAs and nurse practitioners that come through the program as well to learn how to do those things, as well as physicians, but also non-invasive regenerative treatments like with peptides and growth factors that are applied through ultrasound, like TED, transepidermal delivery devices, and things such as that. So all of those things are kind of comported together under the Bauman Institute. My trichologist, Kimberly Jenkins, is world-renowned. She's trained internationally, and they call her the Scalp Whisperer for good reason, because she's excellent not only virtually, but also in person, obviously, to get to the diagnosis of really what's going on at the level of the scalp. Even before we get to the hair growth treatments and procedures, she's the one kind of fine-tuning the scalp for many of these patients. And it's amazing. That department is very, very busy. In fact, we're under construction again. We're building a complete head spa for the scalp, which will be a scientifically tooled treatment that also feels good at the same time.
Wow, head spa sounds incredible. Trichologist. Okay, so we're learning here, which is really, really good. Okay, let's move on to the regenerative medicine sort of protocols. It's PRP, which we know a lot about, but maybe you can speak into that and whether you're using stem cells or not. Obviously, there's that whole movement of lipoaspirate and bone marrow aspirate, even if that is done
Sure.
for the scalp or not. But give us sort of a framework how you would decide whether someone has PRP or has stem cells or then does the hair transplants.
Sure. Well, today, obviously, regenerative medicine is a huge part of the practice. I've been involved with the American Academy of Anti-Aging. I was part of the first class certification on stem cell therapy that the A4M put together many, many years ago. I was actually on the faculty also at the same time talking about regenerative treatments for hair. PRP is done very differently today than it was years and years ago. In the old days, we used PRP basically with a test tube and a pipette to create the treatment. But now it's obviously a lot more sophisticated. We have tuned in on the dosing strategy. What does that mean? It means we measure the blood counts of the platelets and other formed components, white blood cells and such. We have tuned the process of centrifugation and separation so that we're getting a specific dose of platelets. We want about 1.5 million platelets per microliter. That's what the clinical data shows. That's what the research supports in terms of mobilizing stem cells, as well as creating new blood vessel formation, so vascular neogenesis, which are all direct targets of the PRP. We know how to deploy it properly into the scalp. We also know what kind of biologic scaffolds to use with it. So we might use perinatal biologics. I was one of the first to use placental-derived tissue with PRP in combination to prolong the effects of PRP. Our standard PRP is no longer a series of treatments. It's now once a year, basically 10 to 14 months of boost. We could use these biologic scaffolds. We can use synthetic scaffolds such as polydioxanone threads or other things in the scalp to actually prolong the effects of the hair follicle function from the PRP application. We're deploying, remember, about 11 billion platelets at the time of the procedure. And so the biologic and synthetic scaffolds prolong that effect. It works together, as you know, as a regenerative medicine expert. Cells, signals, and scaffolds are the troika or trifecta, if you will, of regenerative medicine. If you have all those three things together, you can potentiate the results. So it's a comfortable process. We don't do it in a painful way anymore. If you've gotten a PRP down the block from your dermatologist and they didn't use local anesthetic, shame on them. And unfortunately for you, that stress response probably inhibited any kind of potential result that you could expect from the PRP. So the physiologic response to stress is cortisol. Cortisol is a hair follicle killer. So if you had a painful PRP, that's like trying to drive a car with your foot on the brake and the foot on the gas at the same time. Not a great idea. So a comfortable ring block is applied so you don't feel the procedure. And then once that process is done, we can also deploy exosome therapy into the mix. We can apply low-level laser light therapy before and after. We can use a treatment like Nano-V, which is a signaling to the body of reducing oxidative stress and stimulating the healing process. We can stimulate the release of EPCs, which are endothelial progenitor cells or stem cells from the bone marrow using nutraceutical supplements. like what we call StemVoke or the Recruiter or other products. So it's a very comprehensive regenerative treatment that we have today, and it's not a one size fits all. Most people will start off with PRP, our standard. It's working well. You can expect about a 20 to 50% improvement in all areas that are miniaturizing with a single treatment, but then you have to repeat it. And when you repeat it, you will maintain or enhance the result from there moving forward.
Sure. That's extensive, using a lot of other adjunct therapies like the red light and peptides and exosomes. Well done. That's incredible. And then if that's not effective and people want to use the hair transplants, how does that work from your side, from the robotic side? And, at Bauman Medical doing it for so long, why is it so unique at your clinic?
Sure. So, I mean, obviously, all those things that we've talked about, whether it be lifestyle changes, tuning up the scalp health, using PRP, regenerative treatments, growth factors and peptides, red light, even pharmaceutical therapies, which we can go into more detail, they're not going to bring back a follicle from the beyond. So, if the follicle is dead and gone, there's no sign of life. Under the microscope, we see just a vellus hair, and that's it. There's no potential regrowth possibility. Transplantation is the only and definitive cure for the balding pattern. And so transplanted hair comes from the sides and the back of the scalp. It's viable for both men and women with depletion of density, as long as they have good hair around the sides and the back, which we'll measure. Individually, those grafts are now harvested. So there's no longer a scalpel incision. There's no stitches or staples. There's no long, prolonged, painful downtime anymore. With regenerative treatments, we can get you healed within a week, if not shorter. It's amazing how fast these patients will heal from their procedures with the adjunct of regenerative therapies that we're doing, whether it be PRP, exosomes, or other things that we might add into their regimen postoperatively. But we're taking each individual graft, which contains 1 to 3 hair follicles individually, and we're implanting them into the scalp in an artistic pattern. So unfortunately today, in the bargain basement shoppers of medical tourism, you end up with a straight line on your hairline, and hairs that are exiting the scalp in a radial fashion, which is not normal. You want to have a surgeon has an aesthetic eye, an artistic eye, to create a natural shape to the hairline that blends the frame of your face into the final result, and can angle and orientate the position and location of the hair follicles so that it looks normal and natural, like Mother Nature created it, and not some mechanized process or cookie cutter, laser straight process. That's not what you want. So robotics are exciting. I mean, we've used the robotic hair transplant tools in the years past. I always remind folks that, hey, robotics in hair is not a new thing. It's been out in a FDA approved since 2011. I was one of the first surgeons to use robotics. I've been to many robotics conferences, hair restoration robotic conferences over the years. But today we use a more fine-tuned manual handheld instrument that is controlled by a device that kind of looks like a fancy iPad with a box. And basically what that allows us to do is tune the twists and turns of the actual punch, if you will, the action item that goes after the hair follicle. And now we can take the hairs without trimming them. You cannot do that with a robot. So this allows us, for longer hair patients, to be able to harvest hair follicles without giving them a super short haircut. And our techniques of implantation also do not require any shaving. So the no-shave hair transplant or long hair transplant is something that we're really well-versed in. It's something that we offer. Not every patient is a great candidate for that. It does have some limitations. But the most important thing to know is that our procedures today are artistic and minimally invasive. So the recovery is pretty quick. You're back in the gym in 4 or 5 days. The crusts are gone in a week, and the hair growth is going to start real quick. Sure. Typically 6 months is what it takes to see half of the result, but we can accelerate that with stem cell therapy like exosome treatments.
Great. But then they have to maintain, once they've had the transplants, they're going to have to maintain that hair through sort of lifestyle and through treatments.
Well, remember, the transplanted hair, as long as it's been harvested from the correct areas, which are the sides and the back of the scalp, the donor areas, those are the safe donor zones. Those hairs are lasting, meaning that they are not impacted by the body's hormones. So the transplanted follicles are immune to hereditary hair loss. It's your other hair that's not. So you must go on medical therapy or other regenerative treatments over the long term if you want to reduce the amount of future transplants that you're going to need. So again, the diametrically opposed opposite end of the spectrum, what we're doing at Bauman Medical, is the long distance tourist cheap destinations. They're not talking to you about keeping your existing hair.
Mm.
And they're expecting you to come back for another heroic restoration in 3 to 5 years. Well, that's not a good plan, because eventually, every 3 to 5 years, if you need a transplant, you're going to run out of your donor hair.
Mm. Sure.
And
All right.
so
And what
if you're
about
running low on donor,
external donors? Do you ever, I mean, it's the first time I've asked that question, but do people donate their hair? Is that a possibility, or does that get rejected?
well, here's the thing. What you're asking about is, what if you run out of your existing hair? What could happen? The good news is that we have other sources, alternative sources on your own body. So for men, we can use beard and body hair for transplantation. Unfortunately, we can't transplant from one person to another because it would be typically rejected. Your body knows its own cells,
Mm.
and it would reject those cells, and it would
Mm.
attack them as foreign materials. So um, and the only true person-to-person transplant that's ever been published is two patients. One was the donor, one was the recipient, and the recipient had already received a kidney from the original donor and is
Wow.
already on immunosuppressive medication. So it was possible and documented that they were able to transplant from that donor hair, from that hair to the other patient. So in
Sure.
addition to the kidney from the cousin, he also got the hair.
Amazing. Amazing. Maybe in the
I don't
future
know if
it'll
it was
be
his
more,
cousin. I'm just saying that.
yeah, it'll be more popular.
Well, the future of hair transplantation, really the holy grail, is hair follicle multiplication, which we don't have yet. But there's a lot of really smart people around the world working on this kind of biotechnology, both here in the United States and abroad. So stay tuned. We don't have the hair multiplication technology yet, but we do have hair follicle stem cell banking.
Wow. Sounds incredible. But let's move on to the pharmaceuticals that are very, very popular. And I think they concern me significantly, the finasteride, minoxidils, and that just, I mean, done natural health and natural medicine for so long. Never had a problem with my hair, so I don't really understand it. That's why I'm trying to gain understanding with regards to why it's so
Mhm.
important to have hair. But what's happening with the latest pharmaceuticals and the side effects that you see?
Sure. So let's talk about those two that you mentioned, the two FDA-approved medications, minoxidil and finasteride. Of course, minoxidil was the first FDA-approved drug for hair loss. It came about serendipitously. It used to be an oral blood pressure medication called Lonitin. And so minoxidil or Lonitin was applied for lowering blood pressure. It was not a very good drug. And what I mean by that is, when patients were taking that medication, they had high heart rate, they retained water, and it could, in addition to lowering their blood pressure. But what those folks noticed is that they had hypertrichotic response. So they had hair growing all over themselves to a much greater degree than they did previously. And so someone got smart, noticed that side effect, and said, hey, maybe this minoxidil would be a good topical baldness drug. And therefore, you got Upjohn creating Rogaine and the eventual FDA approval. And of course, Rogaine was available 2% and 5%, and 5% for men, 5% for women, and then eventually, went over the counter as a generic. So Rogaine was the original. But the problem is that with regular old minoxidil topically on the scalp, number one, it's a hassle, and it could affect the way that your hair is styled if you have longer hair. Even a little bit of hair like I do, if you use minoxidil on your scalp, it can leave a greasy, gooey residue. Especially if you're using those over-the-counter versions, or even today from a cloud pharmacy like Hims and Keeps or Roe or whatever. Those are very, very greasy, gooey mixtures. And so what we've done over the years is develop a more friendly scalp application. There's compounded medications like Formula 82M, which is really the most common replacement for the over-the-counter Rogaine. It's a prescription item that has fluocinolone for anti-inflammatory purposes. It also has tretinoin, which helps with the penetration. But also the tretinoin helps ramp up your body's response to the minoxidil. And what most people don't realize is that some folks are just born with a low enzyme, which is sulfotransferase activity. And if you have low sulfotransferase activity, you're not going to be able to use generic Rogaine very successfully. So those are some ways that we get around that, using a compounded topical version. 82M is something very popular with my patients and continues to be popular. But the other thing about minoxidil now is that we can compound it into a capsule in a microdose. So instead of splitting pills from your local pharmacy of God knows unknown origin, and the generic supply out there, which is terrible, we use a quality compounded version of microdose oral minoxidil. And that can be very effective for hair regrowth. It's been a game changer for patients really through the pandemic, who were dealing with shedding and thinning during the lockdowns, and maybe even because of the vaccinations or COVID itself. Those kinds of treatments like the oral minoxidil has been very successful with a very low chance of side effects. So systemic side effects, as you can imagine, from overdoing minoxidil would be low blood pressure or water retention. And we keep people in the safety zone by using a microdose. And we start patients with a very low dose, women with a little bit even lower dose, and we try to ramp it up as we wish. But very effective, very simple. People find it easier to be compliant and adherent to an oral version of minoxidil than the topicals every day of the week. But you could combine them. You could combine oral and topical minoxidil together and very, very safely and effectively. And it has a very powerful effect on hair regrowth because it increases blood circulation and stimulates the follicles to stay in the growing phase, go in the growing phase, and stay in the growing phase for an extended period of time. And it's not a hormonal treatment, so very, very safe for the body.
Great. Let's move on to
the other medication. Yeah, the other medication, which I'm sure you're concerned about, is finasteride. So finasteride was FDA approved as Propecia back in the 1990s, about the same time as Viagra was, for those who remember, and is now available generically. So finasteride originally was a prostate treatment at 5 milligrams and is a treatment for hair loss around 1 milligram. It has a very strong success rate because finasteride inhibits the production of DHT in the body. DHT is dihydrotestosterone. DHT is the main trigger for male pattern hair loss. DHT has the effect on hair follicles to miniaturize them, to weaken them. So the follicles spend less time in the growing phase, more time in the resting phase. And that's the progressive miniaturization that is common with male pattern hair loss. And so when patients go on finasteride orally, they have a 90% chance of looking the same or better in the long run. That's the good news. 5 out of 6 guys look about the same, meaning that their hair loss stabilizes. 2 out of 3 get some regrowth from that hair growth drug. But the problem is that most people are concerned about is about a 2% chance of sexual side effects when compared to placebo. And that extra 2% of decreased libido or mild erectile dysfunction often keeps folks away from the medication. Now, what I've seen in my practice is if a quality compounded version or name brand version is used, this medication comes out of the system quite easily. Usually within a week, if you're experiencing low libido or decreased ejaculate volume or mild ED, these things turn around very, very quickly as pharmacologically the finasteride is excreted and expelled, which takes, like I said, about a week. Obviously, if you're not on the medication anymore, then the effects of DHT are going to continue to miniaturize the hair. And remember that DHT has a variable effect on folks because that's what's inherited, the sensitivity to DHT. So it's not that you're born with too much DHT happening or too high of enzyme activity, but it's usually that you're just sensitive to it. And that's what causes early or premature male pattern hair loss. DHT can also affect women in postmenopause age. So women who are postmenopausal can notice DHT effects on their hair. And especially if they go on hormone replacement that includes testosterone, many women will start to notice a male pattern shape occurring at their hairline. And that can be mitigated very simply with the use of finasteride. So if you're afraid of finasteride orally, even all the good stuff that I've just mentioned, that it can come out of your system, and I've had very good success rate with it, and well documented in the clinical literature, you can now use a topical version of finasteride. And it's a very effective way to get the finasteride into the scalp at the level of the follicle where the DHT is causing its harm. DHT is produced at the level of the follicle, and so it can have an effect right there. And that avoids the systemic or massive systemic absorption of the finasteride and can help mitigate the onset of sexual side effects in most patients.
But I mean,
persistent side effects that you mentioned.
Yeah,
I want to talk about persistent side effects because remember that, decreased libido, mild erectile dysfunction, very subjective, very psychological effects. And we know that men after the age of 30, at least at age 30, about 10% are already experiencing some decrease of libido and mild erectile dysfunction. And, is that due to lifestyle or toxins or nutrition or other factors? Substance abuse is a big deal, alcohol, cannabis, and all the other more toxic medications out there. can affect libido and sex drive and sexual performance for
Mm-hmm.
sure. And just about anything that affects circulation is going to have an impact on all of those things. And the sexual function, is it the brain, is it the body? It's very tightly connected. So
Right.
I always ask for patients if they are at risk for anxiety, depression, have they been on antidepressant medications? These are also risks for erectile dysfunction, low libido, and so forth. And also their lifestyle habits, if their sleep-wake cycles are dysregulated, if they're inflamed, if they're metabolically insufficient, if they've got insulin resistance, a lot of these things are canary in the coal mine. Sometimes the ED is the beginning of heart disease, cardiovascular disease, brain dysfunction, and so forth. So this is all related, as you know, in the world of functional medicine.
Mm. But we're not concerned. Do we know enough about DHT? I mean, dihydrotestosterone. I mean, I had Carl Gillett on the show, incredible, it was on the Human podcast talking about this and talking about DHT and talking about just the unknowns regarding that and just muscle health and muscle-centric medicine and that. What is your perspective on, just messing around with DHT?
Yeah, well, I mean, look, I've been on finasteride for many years and have had no issues or side effects from it. Just as active as I've always been in all areas, and many of my patients are the same. So I can only go from my experience. I do know that DHT is an important component, maybe also in the brain and other areas of the body. But remember, also, we're not depleting it completely with finasteride. And in fact, there are stronger medications than finasteride. You could use dutasteride to further reduce the effects of DHT. And also remember that sometimes we do genetic testing to find out how metabolically active these pathways are. So the 5-alpha reductase pathway, there's basically two main pathways to get to DHT. There's the type 1 and the type 2 5-alpha reductase. Type 2 being the primary pathway, which finasteride blocks. But if you have a very active type 1 pathway, which again we can elucidate through a genetic test, maybe your DHT level is being kept elevated a little bit, which could be helpful, for that brain function, but also giving you that little bit of lower DHT than normal is protecting your hair to some degree.
Got you.
So if folks don't want to be on a DHT inhibitor or DHT enzyme inhibitor, then certainly things like saw palmetto might be a good option for them. Doing the medication topically or even through mesotherapy applications directly into the scalp so that it depots there and doesn't go systemic as much could be very, very nice options for those patients.
So
but having treated,
you take the finasteride and you basically do mesotherapy, you do some micro injections in the scalp and it stays a lot more local.
Dutasteride mesotherapy, I would say, is a little bit more common. It has a little bit higher molecular weight, so we believe that that's why it's sticking around in the scalp a little bit longer. It also is blocking both pathways right at the level of the follicle. We start off with the dutasteride mesotherapy once a month for 3 months, and then every 3 months after that. But it's based on the measurements. So many patients will have a very profound effect from the mesotherapy dutasteride. It was actually in Europe, I think in Italy, where a lot of that preliminary research was done, which looked really, really good. And then now more recently, within the past few years, we've had the sterile injectable mesotherapy dutasteride available. And the patients that have done it have been very, very happy with it, I have to say. And we've noticed a very nice response from dutasteride mesotherapy without any kind of issues as we were worried about.
Yeah, brilliant.
Yeah, look, hacking our brain function, there's other ways to enhance brain function, whether it's simple things like caffeine and other, NAD pathways and things like that. So, but, it's all part of the mix, and if for folks who want to protect their hair, I have a very, very close friend. He's like paranoid about his hair and he'll do anything just about to keep it. And, we want to have those options open and available and tailor them to the patient's own individual risk tolerance and track the measurements.
Yeah, exactly. I think that's the difference. People are getting these drugs and they're not getting measured. They're not getting tracked. Sometimes they're not sure about what's going on. They're so busy. They're corporate executives, they're business leaders, they're entrepreneurs. And that's what I have the problem with is if you don't have this assessment and then reassessment, I think it can go a little bit pear-shaped at times. But let's talk about peptides and, even the graying of hair. I mean, you see my hair, maybe possibly this can be a little bit of a personal question is what can you do for graying of hair And are you using peptide creams, peptides injections, the use of red light therapy? And maybe you can even comment on sunlight. I have a theory, and sunglasses and hats the whole time. Living in Africa here, I'm just not sure that we're getting enough sunlight on our skins, and the sun has been vilified because of too much of it. And I always say it's dose dependent. You can take 25 liters of water in a day. It's not healthy, but the correct dosage is healthy. So maybe speak into the graying of hair, and then what other sort of advanced techniques you're using.
Yeah, so gray hair is a really interesting problem. It's been looked at and studied many different research facilities around the world, and especially here in the US, are looking at gray hair. There's been a lot of progress in understanding what's going on with the melanocyte population. Once those melanocytes, which are the pigment producers, are completely depleted, I think much like that when the hair follicle function is beyond repair, there's not much hope until we have something more heroic. The question is, what can we do to maintain that cell population? I think a lot of the research, we don't have a miracle cure. I'll just throw that out there, just so everybody knows that there's no like magic cure.
Come on.
This is not like some ancient Chinese herb, okay? He wo shu, or whatever it's called, he shou wu, which means like, Mr. Dark Hair or something like that, from 5,000 years ago, is not the miracle cure. But here's the thing we do know: many biohackers out there obviously do color their hair and will readily admit it. And sometimes they'll be treating their hair, meaning actually treating the scalp with something, but they're also dyeing their hair. So please pay close attention to what their protocol is, because someone may say, oh, I'm using all these magical ingredients, but yet I also dissolve a tea bag in this solution that I soak my hair in, okay? Yeah. So look, dark tea has been used for centuries, if not millennia, to darken the gray hair, okay? So that having been said, are there specific ancient Chinese herbs that can help protect the melanocyte population? That remains to be seen. Me personally, my experience is that I've seen a lot of clinical evidence for copper peptide. So copper tripeptide, copper GHK is a common, commonly comes up in these conversations for skin health and hair growth, as well as gray hair supporting. So you need copper to maintain the colorization of the hair. And in fact, in my own practice over the past several years, we've developed a peptide formulation that we can now prescribe and dispense to patients. It's a non-pharmaceutical. It contains copper peptide and actually several other peptide derivatives that patients will use at home. One specific compound in the morning, one specific compound in the evening. We call that PepGrow, PEPGRO is kind of our nickname for it. We also use the transepidermal delivery system, which is made by Alma TED, that uses copper peptide, thymosin beta-4, and a number of different other ingredients to actually penetrate the scalp. VEGF, FGF can be pushed through the skin using this ultrasound technology. And that's a treatment that's once a month in the office, non-invasive, makes you pretty sleepy, relaxing. It's just a vibration that you hear while it's undergoing. So those kinds of therapies in the office and at home. But let's talk about the cutting edge research. I was super excited to be involved with Dr. Ralph Paus's group in the University of Miami. We've worked many, many years with him. He's one of the most prominent hair biologists on the planet. You can look him up in, PubMed and all the other ResearchGate locations. For those of you interested in looking up Dr. Paus, P-A-U-S, he is the preeminent hair biologist probably on the planet, amongst the top, if not the top. And so his group out of University of Miami does utilize some of our donated follicles to do their testing. They're the ones that elucidated the fact that hair follicles can actually smell, that they have a response to odoriferous compounds such as sandalwood and sandalore and other things, as well as and to increase hair growth, as well as bitter compounds to decrease hair growth. But more importantly, on the topic of the gray hair, is that they've done some testing and it's been published. You can look it up. We can put it in the show notes if you'd like. Absolutely. On rapamycin in vitro. So rapamycin, well-known anti-aging compound, has been shown to stimulate anagen as well as repigmentation in the hair follicles, obviously in the test tubes, in the Petri dishes. So stay tuned. We're in the process of testing and trying that on the scalp. We have our own specific formulations that we use for that we find are more scalp friendly than some of the other ones that are out there. So a very, very interesting hair regrowth and potentially repigmenting compound. We just have to find out what the right dosing strategy is, because if you overdo it and you do it wrong, you can really create some irritation and you can really create some havoc on the scalp health issues. As we said, as you mentioned, the dose is in the poison is in the dose, right? And
Absolutely.
so hormetic stressors obviously have some benefits to the body, whether it be hyperbaric or other things that you may be thinking of, but too much is not a good thing. So it's probably there's a sweet spot for the rapamycin dosing, just like there is for anti-aging properties.
Mm,
So stay tuned. We're still on the march,
mm,
figuring this out, and happy to be working with Dr. Paus and his team at the University of
mm,
Miami on this.
mm,
Very exciting progress and
mm,
potential for pigmentation regeneration.
mm. So in summary, at this
Oh,
stage
you wanted to know
now,
about laser therapy. So
yes, yeah,
I was
yeah,
unpacking that. So
no
we should
problem.
probably talk about red light.
Yeah.
I'm a huge red light fan. I got my first red light device in the office in 1999.
Mm,
A distributor from Europe had to twist my arm to put it in the office, and I was highly skeptical. And of course, we rounded up all my friends and family to go under the treatment so I could disprove that it would work. I said, "This is a hocus pocus. It's never going to work. This doesn't make any sense. No one ever taught me in medical school how light energy affects the skin, other than a sunburn, other than UV radiation. We can take a deep dive into that, or
mm,
vitamin D for that matter."
mm,
But I have to tell you that in 1999, patient after patient after patient had improvements in scalp health, improvements in hair growth, improvements in hair quality, quantity, texture. Even people that didn't even want hair growth improved. I mean, I have my wife's stepfather has like basically just a Norwood 7 white hair around the sides and the back. And his stylist said, "What the heck are you doing to your hair that's making it grow like that?" I mean, it was growing curly and shiny out of the back of his head. It was this huge, crazy looking space age, almost looked like a big hair dryer device that spun around the scalp. I mean, it was a crazy, cumbersome device. But anyway, so the point is that for many, many years and tens of thousands of patients, we've treated with low level laser light therapy. And in the early days, we didn't know why red light affected the hair follicle. But today we know the answers. Dr. Michael Hamblin, who is the godfather of photomedicine research out of Harvard and MIT, and or I should say Harvard and Wellman Center for Photomedicine, and did the lion's share of research to determine the pathways that photons are basically activating the mitochondrial electron transport chain at the level of the cytochrome C oxidase compound. That molecule absorbs the photons of light and converts it essentially into cellular energy, or ATP. As everybody knows, the more ATP, the better the cell's going to function. And so you get a cascade of events: anti-inflammatory, increased blood flow, better hair production, increased wound healing of the skin, rejuvenation of the skin at the appropriate wavelengths of light, 630 to 670 typically. And there's some other wavelengths that have some functions too, but that one in particular is great for hair regrowth. That's what activates the cytochrome C oxidase. And so applying that today with a device, step
mm.
forward 20 years now, this is the
Wow.
Bauman Turbo Laser Cap. It
Wow.
has over 300 diodes. It's a flexible portable device. This is not a bike helmet. Okay. This can unsnap and pack flat in your luggage. This is the device that I personally use every single night for 5 minutes.
Wow.
And it snaps together like this. Gives you a very, very powerful effect, not only on the front of the scalp, but also in the occipital zone for healing
Mm,
after a hair transplant. The Bauman Turbo Laser Cap is award winning. It was designed by the original laser cap inventor, Dr. Michael Rabin, and his optical physicists from MIT, and corroborated with the research done by Dr. Michael Hamblin at Harvard and Mass General and the Wellman Center for Photomedicine. So this is the culmination. This is the pinnacle of laser light therapy today. The Bauman Turbo Laser Cap, 5 minutes, over 300 diodes. It's got they're finely tuned for specifically for hair regrowth. It's the most powerful,
mm.
most portable device on the planet for hair regrowth. And that's the
Wow.
one I recommend that you should use.
Yeah, well, I was just about to ask you. You said hair growth, but in terms of limiting basically the increased gray hair, I'm sure it should make a difference if it's affecting the electron transport chain.
Absolutely, because when the follicle, when the cellular function at the mitochondria is working well, the follicles are working well. Just about anything that disrupts mitochondrial function is going to impact your hair growth. And so that's why there's so many different things that are out there now targeting the mitochondria that could synergize with laser light therapy. And we're working on some specific nutritional and topical formulas specifically for that effect.
Well, we've come to the end of the show. If you've now still listening, we've got the top, hair transplant surgeon in the world, but it's not only a surgeon. I mean, he's doing red light therapy, it's peptides. His knowledge is extensive. I mean, you can hear this. He's been voted the top surgeon over the decade, hair restoration surgeon. So I just want to declare favor and blessing over you, Dr. Alan Bauman. You're doing incredible work. You're committed. It's not only what you can do in the office. Yes, the PRP, there's a place for it. You're treating the patient very uniquely based on their needs. Yes, you might use dutasteride, you might use mesotherapy, there's peptides, there's creams, what you can do at home. There's low-level laser. You develop a helmet. I mean, you can go on and on and on. And so well done as a pioneer, someone who's really just propagating something that I think is crucially important for people's self-worth, their confidence, and I think it's important. So just an absolute privilege and pleasure. I do need to ask you offline about these products. I'm sure they're not going to be taken by the port health authorities, but let's discuss that over, and maybe you can just leave a message of hope for people. I say this to all my guests over the last 4 years because there's just so much despair. There's just so much discouragement with health and wellness and performance. And, it's just crazy out there. I've never seen disease increase to this degree in 25 years of practice. So leave the audience and the viewers with a message of hope, Dr. Alan.
Yeah. So, I mean, that's what we started with, right? The incidence and the effect of people who are having hair loss. We're seeing so much more of it. But the good news is that if you're out there and you're seeing your hairline recede, or you're seeing changes in your hair, the texture, the quantity, the color, the volume of it, you're seeing your scalp shining through in different areas, man or woman, no matter what your age, it's okay to be concerned about it, but it's not okay to just let it go. So if you'd like some information about how we treat hair loss, obviously BaumanMedical.com has got thousands and thousands of pages of information, hundreds and hundreds of hours of video content and articles that I've published that you can use as a research tool to guide you. Because again, there's not that many physicians that are out there. But most importantly, you can ask a question if you're concerned. You go to Bauman Medical, Bauman, by the way, Bauman medical.com/ask. And you can ask any question you would like, and I will get that answer out to you through my team regarding hair loss. Obviously, not a great stock pick, but or the weather, but regarding hair loss or hair restoration, I'm happy to answer those questions. But to get a complete evaluation, you can do that from the comfort of your home or your phone anywhere on planet Earth currently, and perhaps maybe eventually even on Mars. But now we're working mostly with planet Earth. You can do that through BaumanMedical.com, and you just click on the button for evaluation or consultation. And if you happen to be visiting the South Florida area, we're not far from Miami. Boca Raton is a beautiful destination location known around the world as a crossroads, international crossroads. We're just about a couple of minutes from the beach. You could play golf and have some fun in the sun. But if you can't leave your home, or you like to get a consult from your phone, you can do that too virtually, and I'm happy to connect with you. You won't get the benefit of those AI-powered microscopes or the other, hands-on stuff that we do, but certainly we can have that conversation and try to find some help for you wherever you are in your hair loss journey. We hope that we can be a stepping stone to the next level up. So if you're looking to increase your hair span, right? Because we're all working on our lifespan and more importantly, our health span.
Yeah.
But if we're increasing our hair span, we hope that Bauman Medical would be your choice. And I look forward to helping you if we get the chance to do it.